Hello ladies and gentlemen, welcome to our live session today. I'm so honored to have Dr. Felix Yap, the consultant dermatologist from Sunway Medical Center, and Mr. Param. And my name is Anjoe Koh to share with you the journey of living with psoriasis. So let's start with the basics, shall we? Dr. Felix Yap, I would like to ask, what is psoriasis and how many Malaysians are estimated to suffering from these conditions?
Yeah, thank you. So psoriasis is actually a chronic inflammatory skin disorder. So inflammation means there is a lot of inflammation, there is a lot of redness, there is a lot of things going on under the skin in psoriasis.
Okay.
So psoriasis not only affects the skin, it affects the nails and it affects the joint as well.
Okay.
So it's kind of a systemic disease, and there is no proper study done in Malaysia to see how many Malaysians have it, but we know that estimated around 2 to 3%. So to 2 to 3%, you see the figure is very small, but when you look at 30 million people with Malaysia having psoriasis, 2 to 3% is actually quite a significant amount of people who has psoriasis.
Yeah, working as a pharmacist myself, I do encounter a few patients that are walking in complaining about psoriasis, or the families or friends member that are suffering with psoriasis as well. So it's very important for us to discuss about this topic today. So is there any certain group of people a higher chance of getting these conditions?
When you look at psoriasis, a lot of times you look at genetic predisposition, and when you look, you ask patients with psoriasis whether they have family history of psoriasis. Around 30-40% of them do tell us that yeah, my grandma has psoriasis, my mom has psoriasis, my auntie has psoriasis. So it's basically a genetic disease, and based on research, we have found that there are many psoriasis genes that we isolated, but generally those are predisposed to genetic. They tend to get psoriasis much earlier on. So later on the disease, there might be other factors that triggers them to get the psoriasis. So psoriasis affects everybody. You can get psoriasis when you are really young, or you can get psoriasis when you are really old. So you cannot say genetic disease only you baby, you don't have psoriasis, you don't have psoriasis. So it's
just a matter of timeline that we will suddenly flare up.
Yes,
like that. Okay.
yes. So genetic plus some environmental factor, pop, the immune system goes into disarray, then the psoriasis will come out.
Oh, I see.
Yeah.
Is it possible to totally prevent this condition at all?
I think the research at the time being up to date, there is no prevention. But scientific research is going on and on and on. So hopefully one day we will find something that will help us prevent psoriasis. But for now, there is no prevention. Even good diet, supplement, exercise, it doesn't prevent psoriasis. So if it wants to come out, it will come out.
Or it's just a matter of time that one day or suddenly just pop. Okay, so what is the sign and symptom that we have to be alert about when we have psoriasis?
We need to be, usually psoriasis affects mainly the skin, so sometimes it affects the joint and the nails. So the first thing is the skin. So we need to look at the skin. The skin, usually there will be red, a plaque. Plaque means there is a slightly elevated skin lesion with a lot of scales. And usually it starts off on the scalp. You can get it at the elbow, the extensor elbow, the extensor of the knee, the navel, the lower back, the butt cheek cleavage. These are the normal areas we can get it. But you can get it basically anywhere that have skin. And then the second thing is that this patient tends to have changes of the nail. You get pitting of the nails, and then you get separation of the nail plate from the nail bed. So it's like some A inside your nail. You look at your nail, there is an A at the edge of the nail. So that might be a sign of psoriasis. And of course, you get joint pains. If you get joint pain, sometimes your joint will be so swollen. We call it enthesitis. And then medical people, we call it sausage digit, because your whole finger looks like a sausage.
Oh, okay. So
yeah.
How many percentage of psoriasis patients that will actually go into arthritis in the end?
Different studies have different. If you look at dermatologist study, they think around 10 to 20%. But if you look at rheumatology study, it goes up to around 40%. So 10 to 40% of people actually have joint disease. And we know that the joint disease is more common in those with nail disease, and it's more common if you have psoriasis for a longer period of time.
So those who are living with psoriasis in a longer period of times, or they tend to have like nail problems when they are having psoriasis, are more susceptible of catching arthritis in the later terms.
Yes, and it's very, very important for you to associate nail psoriasis and the joint psoriasis with the skin psoriasis, because some patients present with joint disease first before the skin comes out.
Oh, the other way around.
Yes.
Okay.
And a lot of people have 1 or 2 skin disease and joint disease, and a lot of people with joint disease thought they have rheumatoid arthritis. And eventually when we look at the nails, we look at one of the 2 skin, it actually is psoriasis arthritis.
Yeah, and then what I learned is psoriasis arthritis and rheumatoid arthritis is the way of they appear. Some is like asymptomatic.
Yes.
And rheumatoid arthritis is like more balanced, right? Am I right?
Yes, rheumatoid arthritis tends to be what we call it symmetrical, but psoriatic arthritis is
like one-sided, either one part of the body.
They might be here, they might be here, and the worst psoriatic arthritis is at the back. You get the whole spine getting disease, so you have problems with going up, turning. There are many types of psoriatic arthritis, but we need to just be careful. If you have arthritis, look at the skin, see whether there is any skin disease.
Because the treatment between the rheumatoid arthritis and the psoriasis arthritis is different, right?
It's totally different.
Yeah, so it's very important if you have skin conditions and also have a joint problem, it's very important to go and seek for the consultants from the doctor. Don't self-treatment it because you might go undiagnosed. So we have Mr. Param here going to share with us the journeys of his life living with psoriasis. So hi Mr. Param.
Hi.
How long have you been living with psoriasis and when were you diagnosed?
First started in 1986. I spotted it in my head. It's like I thought it's a dandruff.
Okay.
So it's like when I comb, it's like white spot, white scale drops.
So it's like a big flaky flakes. Okay.
Then only I seek skin doctor. Then he prescribed this psoriasis.
Oh, okay. So you start with the scalp first. Is it itchy, or is just because it's very irritating to have the flakes?
Yeah, it's just a flakes. It's not itchy.
No itchy.
But just like irritation. So you can see it on your shoulder and all this.
Oh, okay. So how did you find out about conditions and what were the initial onsets apart from the scalp thing?
After the scalp, I spotted in my leg.
Oh, so it moved to the legs. So it's
black
like
patches, then become flaky, then continue with the medication.
Okay. Okay. So what are some of the challenges that you face when you're having psoriasis?
Initially, I feel so embarrassed to go out or take public transport or anything, and then outdoor activities until like family members and close friends understand the situation after I explain to them. But within the family members, yes. But when you go to the public, I really reduce all the public, outdoor activities and go to the public and all that. It really affected my outdoor activities.
I see. So before we start this interview, I do have some, communications with Mr. Param and when both of them met. So I've just heard that Mr. Param met Dr. Felix like 10 years ago, 11 years ago.
Yes.
So like when you first start with your scalp, flakiness and then move down with your joints, and what kind of treatment that you tried before and it failed and you finally decided to go to Dr. Felix?
I was started with the ointment.
The ointment. Okay.
And doctor prescribed some steroids. Then I feel some side effects.
Okay. What are the side effects that you get?
My kidney affected because of the steroids and too many pills I was taking. So somebody recommended another doctor. Then I went to Dr. Felix.
Yeah, definitely go to the specialist.
Yeah.
So it's like after you met Dr. Felix, and it's what kind of treatment that you start with Mr. Param in the first place?
Initially, we started off with creams, and then later on, I think progress of psoriasis gets better. Then we go on to a medication called biologic. It's an injectable. So these are the newer medications. And at that time, Mr. Param was on very strong medications, and I think Mr. Param said it affected the kidney, it affected some of the liver. So we decided to give him something that is safer and then can have better control. All these are newer medications, so treatment for psoriasis is evolving. So we tend to go together with evolution and then give our patients the best available treatment to date.
What are the available treatments nowadays for psoriasis?
It's basically divided into three types. One is the mild one. We usually give them creams. There are multitudes of creams that we can give them. The second one is phototherapy. Phototherapy means I shine you with light treatment. So phototherapy usually is the UV light. So you can get UV light treatment, but UV light treatment have to be very persistent, and a lot of times people cannot do it because of logistic problem, because you have to go to the hospital 3 times a week.
To have these facilities three
Correct.
times
three times a week, and then you have to go over a period of 4 to 6 months. So a lot of times when you work or you study, then there will be problems because hospital is only open during the office hours. So it will affect your works and everything. And then number 3 is that we give oral medications and also injectables. So the oral medication that traditionally we give is immunosuppression. Immunosuppression means medication that pull down your immune system. Because psoriasis is an immune system disease, anything that weaken a bit of your immune system, it doesn't fight the skin, and then the skin will get better. But now we use more advanced treatment, more state-of-the-art treatment. We give something that doesn't pull down your immune system, but something that block off a chemical mediator that cause psoriasis. So it's just blockade of the chemical mediator, then the psoriasis will get better. So the side effect profile for those chemical mediator inhibitor is much better compared to something that generally pulls down your immune system.
Yeah, I believe that as well, especially in this current pandemic, seasons. It's best to actually boost out your immune system rather than just pulling it down. So, is this curable?
Psoriasis, unfortunately, is a long-term disease lah.
It's a chronic illness.
It's a chronic illness. You can get total clearance of psoriasis with good treatment. With a bit of luck, you can get your psoriasis totally under control.
So but no symptom at all.
No symptoms, no rash, no joint pains, nothing, and it might come back. It might come back.
Okay.
It might come back. So definition of cure means I clear you off. It never comes back.
So once my illness is clear, can I just totally off my treatment at all, or I should maintain it even though I'm asymptomatic?
It all depends on the severity. The mild one, yes. The severe ones, we need to monitor for a period of time before we decide to off everything.
Okay.
Yeah, the mild one, yes. Once it clears, yes, you can go it off.
Okay, so how would patients know if they need additional treatments for their conditions?
I guess you have to see a doctor to see whether they need additional treatment. But generally, to be on the safe side, if you go and get your own self-treated, do not take any oral medication. Because your oral medication might contain steroids, and actually all these steroids will get side effect. Like Mr. Param say, he has side effect with the steroids.
Yeah.
So
that's the time when he know that he need additional treatment.
Correct.
Because it's not under control at all.
Correct.
And then you're suffering a side effect from the medications and things like that.
Absolutely.
So would you mind to share with us what's the current treatments that you're ongoing right now?
I'm on biology and another pills. So I'm taking Comiley monthly. That is really controlling my psoriasis at the moment.
Okay. Once you start the treatments with the recommendation from Dr. Felix, how long it take for you to clear off all these problems?
Within a year.
Within a year?
Yes.
Okay. So do you suffer any side effect when you've initially taking those medications?
I mean, biology or the steroids?
Both, the biology ones. Yeah.
Biology one, I didn't see any side effects.
So it's like completely just like working miraculously on you.
Yes,
Okay.
working very well, and I'm happy with it.
Okay. So would you mind to share with us, like, are you still suffering with psoriasis at the moment? Are you completely symptom free right now?
No, there is still like maybe 10% of my body part.
10% of your body parts
But
still
yes,
have the
yes.
flaky skin.
Yes.
Okay.
But my upper body are totally clear. So only the palm in my leg part still has.
So what other habits that you're currently keeping up with the treatments with psoriasis?
Taking the biology and then control my outdoor activity without going to the sun too much.
Okay.
And then I myself avoiding some food, which
Oh.
I thought might be allergy.
Might be
But
allergy.
Doctor said it's nothing to do with the food.
Yeah, because
Yeah.
we just heard about
Yeah,
nothing
yeah.
to do with the supplement,
Yes.
nothing to do with the food. So,
Yes.
but we always have a misconception. Maybe
Yeah.
I eat the egg, maybe I eat the chickens, it made me cough more.
Yes, yeah.
Maybe have a mucus and things like that. Is it possible that really link with diets?
You look at scientific research, diet doesn't cause any problem with psoriasis lah. But when you look at psychology, yes lah. Psychology, yes. If let's say my mother keep on telling me that I'm allergic to prawn, even if I'm not allergic to prawn, I take prawn, then
I feel like
psychologically, okay.
Oh, okay. So what
Yeah.
other food do you think that really links to psoriasis? Mind to share with us?
Seafood, certain seafood.
Oh, certain seafood like a shellfish, something.
Yeah, shellfish or squid.
So what did you experience after you eat them? It's like itchy instantly?
No, now no more.
Oh,
I
no,
didn't
no
feel
more.
anything,
Maybe
but
we can
once
go
in a
back
while.
and try and eat
No,
again.
once in a while I'm taking. Once in a while I'll do eat. But only certain like dry fish, totally I stopped.
Oh, dry fish.
Yeah, since
Totally stopped.
1986.
Okay.
Yeah.
How about the skincare choices? Because I do have a lot of patients like reach out to me and say, oh, I have psoriasis. So what kind of skincare I should really avoid? Like maybe alcohol based or maybe certain type of the skincare. And then they will show me a screenshot of all the photos of their skincare and asking my opinions whether to go for this, that or not. Is there anything that I should watch out?
Usually for psoriasis, because the skin is dry, like Mr. Param, the skin is dry, what we advise him to do is actually to put moisturizer.
Okay.
Any type of moisturizer, there are arrays of moisturizer nowadays that we can use. And of course, if let's say the skin gets even more flaky, so we can give combination of vitamin D together with steroids.
Oh, vitamin D with steroid.
Vitamin
Okay.
D with steroids. That is a part of treatment for psoriasis. But most of the time, once you're on biologics, most lesion will go. It's just moisturization. Because psoriasis is a funny disease. Psoriasis is a disease when you scratch the psoriasis, the plaques will follow the scratch mark. So
Okay.
if you have a dry skin and then you tend to scratch, the psoriasis will pop up. So
Okay.
you don't. You have to moisturize your skin properly to prevent dryness of the skin. Then you get better.
And also avoid friction.
Yeah, the friction a bit difficult because sometimes when you move around you can get friction. But as far as we are concerned, moisturize the skin, and then you have to your bathing practice now. You take shower, you use a proper soap that doesn't dry you out. A lot of soap that is more moisturizing are those with lower pH type of soap. So it's more moisturizing for your skin. It doesn't cause much of dryness. Then it will help your psoriasis.
Like those soapless one.
Yeah,
Yeah, soapless one, and then with the glycerines and
Correct,
yeah,
correct. This is always what we call a synthetic detergent lah. It's not soap, it's synthetic detergent. Yeah.
Oh, okay. So shall we totally avoid all those like fragrance types of skincare or those paraben-free things? Because a lot of skincare nowadays they are marketing clean ingredients. So because we have those chronic illness, psoriasis, and or those allergic conditions, so should we really go for those clean ingredients skincare?
If you have psoriasis, not necessary, because psoriasis is not allergy disease. So you're not allergic. It's an autoimmune. It's due to a certain chemical mediators produced in your skin, the body that causes the skin to have problem. So in that sense, you can use whatever you like. But if let's say you have eczema, so we will actually advise you not to use those with fragrance, not with parabens and all those things.
That would really trigger.
Yes, because it can cause contact dermatitis. Those with eczema will get contact dermatitis. Psoriasis is a totally different type of skin disease.
Not an allergic skin condition at all. So psoriasis is autoimmune, it's a genetic conditions. So it's very different with the eczema. So doctor, how can we differentiate between eczema and psoriasis?
So if you look at psoriasis, usually it's not as itchy. You see Mr. Param say it's minimal itch. But if you have eczema, you'll be like a monkey, you'll be scratching all over. So itchiness is main characteristic of eczema, although some eczema don't itch. And second thing is eczema usually affects the folds. Psoriasis affects the extensor surface. And when you look at baby with eczema, usually it affects the face as well. Sometimes adult also affects the face. And eczema is worsened by environmental changes. Things like dust, certain food, this will trigger eczema.
Yeah, the shellfish probably.
Correct.
Yeah,
but if
then explain.
when you look at shellfish, actually shellfish is a cousin of your house dust mite.
Oh, really? Cousin of my house dust mite.
So you know eczema is caused by dust, and dust main component is house dust mite. So if it is a cousin, you are allergic to this, you are more likely allergic to the cousin. It's the same group, it's a shellfish group.
So you would advise all those with eczema patients to not taking shellfish or try to minimize?
Usually I will do a test first, and if the test is positive, then I will ask you to avoid. If no, then a lot of people like shellfish. It's so yummy. So a lot of people like it. So it's sometimes a bit difficult to totally avoid shellfish.
What are the tests though? Is it like a full blood count or things like that? Not right?
No, we can do a prick test.
Or prick test?
We can do a prick test to look at it, or you can do a blood test. I prefer a prick test because prick test is easy. I'll get the result within 20 minutes or so.
Okay, so if you guys have a skin conditions, you can seek for the consultant to do a prick test to diagnose whether you have psoriasis or eczema.
Yeah, that is the part of eczema. The psoriasis part, we don't do any tests. Psoriasis part is usually a clinical diagnosis. Means I see you, I look like this, and then it's psoriasis. There is no test to be done, no blood test.
Oh, no need test. By your experience, you can tell definitely it's psoriasis.
Yeah, so it's usually what we call as clinical diagnosis. We follow the skin, see the skin, the structure of the skin. Then after this, see the pattern, where it is distributed, whether it affects the nails, whether it affects the joint. Then you will say, okay, this is psoriasis. Then we can go on to treatment for psoriasis.
I see. So the flakiness of the psoriasis is because the increase of the skin turnover cells.
You are right. You are right. So the normal skin turnover is around 30 days. In psoriasis, the turnover is around 7 days.
Oh, that's why it flakes so much.
Yes.
Okay, that explains why it flakes so much, and it does not cause any pain or does not cause any itchiness.
Yes.
It's just because the skin turnover cell has been increased dramatically.
Yeah, and the itchiness in psoriasis is much less because there's a chemical mediator that is absent in psoriasis but present in eczema. I think these are very, very difficult kind of topic. There are certain chemical mediators that actually cause itchiness because the chemical mediator will stimulate the nerve will cause the itchiness. But it's mainly absent in psoriasis.
I see. So the treatment with psoriasis, how does it work to really, is it to reduce the skin turnover cells? To control the symptoms or what?
You are very right. To reduce the skin turnover, then we actually block off the chemical mediator. So a certain chemical mediator, once you block off, then the skin turnover, it makes things go back to normal.
Oh,
so it's just like I keep on pushing a car from the back. Your car goes very fast. So I take off something that push, it goes back to normal speed.
Oh, okay.
Yeah.
So will it affect like how my hair grow and things like that? Because if I'm a patient itself, I know that I'm taking this medication is going to reduce my metabolism, so what, like it reduce my skin turnover rate. Will it affect how long my hair grow and things like that, or it's just specific on skin?
It's just specific on skin and joint, and also nails. It doesn't have any problems with that. Psoriasis doesn't affect our hair. Unless you have super severe psoriasis on the scalp, then you have hair loss. Otherwise, most people do not experience hair loss. Do you experience any hair loss, Mr. Param? No.
So apart from medications, just now Mr. Param shared with us that he does try certain shampoo to really stop the flakiness of the scalp as well. Can you explain that as well, doctor?
The shampoo that we use for psoriasis is actually a shampoo. Is either you use a shampoo that moisturizes the skin, or you use a shampoo that causes the scales to go off, what we call as keratolytic.
To remove the flaky scales at all. Okay.
Or you use a shampoo that actually reduce or stabilize the inflammation.
Okay.
Yeah.
Reduce and stabilize. Okay. So what are the most the burdens of the psoriasis patients have to go through?
I think psoriasis is a very stigmatizing disease. Like Mr. Param say, he don't dare to go out, he feels very embarrassed and all those things. So it's a very stigmatizing disease. Of course, for him and the family members, they know that this is autoimmune disease. They are not worried. But if you go to see any relative or any Tom, Dick and Harry, the first thing is that they say, I don't know whether it's infectious or not. I don't dare to touch it.
Do you encounter that in your family's member? Oh, okay.
Usually, yes.
So it's not infections, right? It's just a genetic disorder. You are not going to catch any psoriasis if you are eating with the psoriasis peoples or things like that. So don't like misconcept it as an infection. It's not an infection at all. So we get the confirmations from the specialists. So living with psoriasis is quite difficult. So we have to show some care to them. This is just a genetic disorder, and with the right treatments with the doctor, it can be under control. Yeah. So it's like when you are first encountered with psoriasis, what kind of activities that really limit you?
So I like to play soccer, so I have to stop that. Swimming.
Why have to stop soccer? Is it because of sweat or what?
No, the sweat, and then you have to wear like short pants.
Oh, you don't want to show?
Yeah.
Okay.
And like swimming, traveling, going in a group. So all that affected initially. But after the treatment, I started all that.
Oh, so the quality of life really finally gained back.
You see, when Mr. Param say this, you get very surprised. Why not soccer? So for a normal person like us who has no skin disease, we don't understand them. To them, how they wear their shirt, how they present to people is so important. As a normal person, we are healthcare worker. We just say, small disease only lah, don't care. But for them, it's a big problem. How they wear their shirt, how they present themselves, all are very, very important. So quality of life is a main problem in psoriasis.
So it's also one of your goals when you come in to treat the patients, right?
Correct. So because a lot of times you see a doctor, the doctor don't actually, or any healthcare worker, they don't actually go into that kind of depth to see you are bothered about wearing short pants. So, but that is the main problem of the patient. It's actually not the disease; it's how they perceive the disease caused them.
True. So if you still suffering this kind of conditions, just leave the comment down below. Do you have any questions that you would like to ask the specialist today, or do you have any problems that you would like to share with us? I'm going to answer your question one by one. So feel free to comment down below. So what are the health complications commonly associated with psoriasis? If I've been diagnosed with psoriasis, what kind of the other thing that I should be taking care as well?
As far as we have discussed, is skin, joint, and nails. Psoriasis is far more than that. Psoriasis affects your heart.
Oh, my heart.
And affects what we call as metabolic syndrome. Metabolic syndrome is psoriasis is associated with metabolic syndrome. Metabolic syndrome is where you get diabetes, hypertension, and hyperlipidemia, the three culprit of heart disease. So psoriasis, if you don't control it well, it will make you fat. When you make you fat, your blood sugar will go up, your blood pressure will go up, your blood cholesterol will go up. And if you don't control that, then you can cause cardiovascular disease. It causes heart problem, it causes stroke, and so on and so forth. So these are the things that we want to control with psoriasis as well. So certain biological treatment, they do target a bit of the heart. So it's a bit better if you have heart disease, to get that kind of treatment. And second thing is that when we give treatment for patients with psoriasis, if they can reduce a bit of their weight, the treatment will be more excellent.
Oh, okay.
So actually, the more obese you are, the more difficult to control. The less obese you are, or the weight goes back to ideal, the control will be much better.
I see. Okay. So just like you mentioned about psoriasis will tends to get fat. What is the reason of that? Why it will making me more easily fat? Because of the metabolism drops, or what?
It's the chemical mediator.
Oh, it's the chemical mediator.
The chemical mediator that
so
gives
sad.
you the skin disease is the chemical mediator that is associated with obesity.
I see.
So you block off both, block one, both will get better together.
Oh, okay. We have a patient asking here, is there a certain body type or demographic who will get it easier?
No.
No,
No.
there's not.
No.
There's not.
No.
So it's not because of a certain blood type or certain races or easily get psoriasis and things like that? No.
No.
Okay.
As far as we are concerned, all the three major races in Malaysia get psoriasis. There is no predominance of one over the other. And psoriasis affects almost every race across the board.
Also same gender, the balance, quite balanced.
Of course, when you look at studies, they are sometimes a bit more female, sometimes a bit more male. Then to us, it's almost the same. Female, male, almost the same.
Almost the same. It's okay. So when you are suffering with like flaky skin and things like that, you are not sure whether you have psoriasis or eczema, please seek for the consultants from the specialist or doctor. Don't go untreated, because undiagnosed psoriasis may lead to a serious complication. Just like what doctor just mentioned about, it may lead to heart conditions, it may lead to diabetes, and so on. So, doctor, I would like to ask, are psoriasis patients more vulnerable to the complication caused by COVID-19?
No. Psoriasis patient, if you are just on cream or you're on biological treatment, is the same as anybody else.
Okay.
Yeah, but if you are on immunosuppression, yes, you are more likely to get more severe complication of COVID, because your immune system is a bit compromised. But otherwise, if you don't have any compromised immune system, or you have psoriasis, you have no treatment, it's the same.
It's the same.
It's the same.
Unless you take the immunosuppressant.
Correct.
This treatment, it might lead you to be more susceptible to catch COVID-19. If you are not, you are just basically the same with all of us, that you are not, just more vulnerable to COVID-19.
Yeah,
this is very important to let everyone know.
If you are talking about whether you are more likely to get COVID-19, it's not related to any other disease. It's related to your SOP. If you don't follow SOP, then you are more likely to get. Even if I don't follow SOP, I'm more likely to get. So SOP, vaccination, are very, very important to prevent you from getting COVID-19, not the disease.
I see. Would you recommend psoriasis patients to go under vaccinations, COVID-19 vaccination?
Yes, definitely. Mr. Param, have you?
Yeah, completed.
Completed.
Cannot sit with us today. Okay. So, do you like any advice to give psoriasis patients if they go for vaccination? Any things to be alert about?
If you are on immunosuppression, then you have to stop immunosuppression on the week or one more week after your vaccination.
to stop it.
To stop it.
So the week when you're going for vaccination, please stop your immunosuppressants, and a week after the injection.
Correct.
Okay.
But if you are on biologics, the recommendation is do not need to stop. Usually, what I do is I will get the biologics before and after the COVID-19 vaccination. So I ask you to stop around 1 or 2 weeks before, and after that 1 or 2 weeks after. It all depends on the schedule of your biologics. You can discuss with your doctors, but most of the time, I personally will gap it a bit.
Okay. If one of you want to stop any medication, please seek for the advice from the doctor or the pharmacy. Don't stock it for yourself. This is just a piece of advice that we would like to share with you, but don't stop it yourself. So we have the patients here asking, is there any possibility where the psoriasis just disappear on its own if I don't treat it, or can sweating trigger psoriasis?
Question number 1, does psoriasis go off by itself if they don't treat? If it is mild, yes, there is a possibility that it will disappear. But if it is a severe one, the likelihood is very, very low. Okay. Anything can happen, but the likelihood is super, super low if you don't get it treated. And number 2 is, does sweating trigger psoriasis? If your sweating actually cause itchiness and then you scratch and then the sweating cause dryness, yes, it will trigger and it will make the psoriasis worse. Yeah.
Did you experience that, Mr. Param? So if you sweat, it would trigger your psoriasis?
Yeah, initially yes.
Okay.
Yes, some part of my upper body. But lower body I didn't felt it, but upper body yes.
I
like
see.
the stomach area or the back.
Okay.
Excessive sweat because it's like soaked.
Because of the soak, then you may feel uncomfortable.
Right.
Then you would like to scratch more.
And then
So
it start the itchiness, like triggering the itchiness after you first scratch.
So it's more like a sweat related to comfortness that trigger. It's not because the sweat itself. It's just like sweating make you uncomfortable. Then you tend to scratch more. That maybe trigger the psoriasis.
Yes.
Okay, so it's like, okay, if I wanted to be smart about it, I try to spray deodorants or whatever to control the sweat. Will it work?
I guess we are staying in a tropical country. Sweat is part and parcel of us. So all these funny things, I think probably is for your comfort. It doesn't work much. We do have medication that controls sweat. I can give you oral medication to control your sweat.
Oh really?
But,
that's amazing.
But you are staying in a tropical country.
Yeah, summers, all-time summers.
So if sweat causes you problem, maybe it's time for us to move on from
outdoor activity. That's sad though.
Yeah, but you can't do anything. Or the other thing is you move to northern hemisphere or southern hemisphere and then stay there.
Okay, we have an audience here going to ask Dr. Felix, does eating food that contain gluten trigger psoriasis? Gluten? Psoriasis?
No, psoriasis is not associated with any food because it's not allergy, but there is a big hype of gluten with eczema.
Oh, gluten with eczema. Yeah, because psoriasis is a genetic disorder. It's not an allergic skin condition. So with any type of the food, it does not really directly link to psoriasis. Just because maybe you have eczema, it might really cause the contact dermatitis, but not with psoriasis.
A lot of people with eczema don't know they have eczema. They thought they have psoriasis. They take certain food, the eczema will flare up. So that might be eczema.
Oh, that might be the eczema. Okay, cool. So what is your advice or recommendations for a patient who is living with psoriasis in the new normal endemic right now?
For me, I tell all my patients to be like normal. Normal.
Just follow the SOP.
Just follow SOP, act like normal, go and do your exercise, go and eat whatever you want.
Take your vaccination.
Don't be so fat.
Don't be so fat, yeah, because your chemical mediator will really, affect how your weight going to shed off.
Correct.
So it's very important to keep yourself fit. So your treatment can be, more
healthy lifestyle means no smoking, no alcohol, exercise. And
so your target treatment can be more achievable as well. So you remember to keep yourself fit as well. So yeah, there's one myth I would like to ask as well. Does taking supplements help me to cure psoriasis? Maybe taking some skin nail supplement, there's a lot tons there. It's like I'm going to take vitamin E, I'm going to take collagens or things like that. Will it make my life better? Enhance my treatment as well?
I guess scientifically, because we are people of science, we study medicine, we study science. Scientifically, as long as research is concerned, no, there is no help between psoriasis and supplements.
No, there's no. So if you are living with psoriasis, please seek for the advice from the doctor and a specialist to cure. Don't go undiagnosed, because undiagnosed psoriasis can lead to a serious health complication. And there's no single supplements in this world going to really treat psoriasis. And even though you're with psoriasis, and even though you are going asymptomatic, you are still need a maintenance of the treatment as well from the specialist. So, yeah. We have the audience here that would like to ask Mr. Param, has the psoriasis affected your work life or your personal life?
Initially, yes, and still. Some part of it, like big gathering, so like I can't take off the shirt like anywhere I want, like public swimming pool. I already avoided long ago, unless I wear like long tight pants, swimming pants. Upper body is okay, but only lower body I cover it. But it's just for myself. But if somebody sees, I don't want to like trigger them, like why this guy is like here and all this. So I just keep avoiding it.
But right now you can be more confident in showing, because like from real life right now I'm seeing Mr. Param, I cannot tell that he's a psoriasis patient because the skin is flawless, the scalp is perfectly fine and things like that. So apparently the treatments work amazingly.
Yes.
Yeah, so I'm happy for you, Mr. Param.
Thank you.
And then there's the second questions from the audience. They would like to know, have you needed to take leave from work or social events because of that?
No, basically I take leave just to see doctors.
Yeah, so
otherwise I'll just take annual leave or somewhere I want to go, like vacation or anything. I mean, initially I didn't go any vacation because of this condition. Now I'm just going wherever I want with my family and friends.
So the quality of life
Yes,
is
much
better after
much
the treatment. So it's very, very important to get diagnosed and get treated properly. So we have an audience who would like to ask Dr. Felix, will stress and inconsistent sleeping schedule make psoriasis worse?
Yes.
Stress will make it worse.
Because
it affect the chemical mediator or?
Yes.
Oh,
the immune
okay.
system. Anything to do with immune system, stress will make the immune system go haywire, and then it will cause not only psoriasis, any type of skin disease is worsened by stress.
I see.
So usually stress can be either physical stress or mental stress or psychological stress. All these stress will cause your problem. No? So if you can sleep well, you can open your bowel well, you can eat well, then everything will be okay. If you don't, all these three have some problems, then you probably get, your psoriasis will actually get worse.
I see. So do you ever encounter that, Mr. Param, that stress really triggers psoriasis?
Really. Yeah, that when doctor recommend me like go for vacation now and then. So that really helped me. Like, so I make sure each year I go for a vacation, like 1 week, 2 weeks, or twice a year.
That's
that
good.
Really,
that's good.
Yes, really helped me.
That's
Even
very
like,
important to relieve your stress, because stress not only trigger your chronic illness, it also will affect your mental health and things like that. So it's really important to go stress-free once in a while. Maybe go for vacations or maybe have a drink or two. So can psoriasis have a drink or two? Would it affect their psoriasis?
You can drink, but within the norm lah.
The norms. Yeah, of course.
Yeah.
Within the recommendation limits.
Yeah. So please be careful. Don't drink and drive.
Yeah, of course. That's more important. Maybe drink have a little sip of wines and things like that,
Correct.
just to relax and things like that.
Right.
So we have an audience who would like to ask, psoriasis and eczema, which one is more common?
If you look at your data on eczema and psoriasis, eczema is so much more common. Eczema affects around 20-25% of the population. Psoriasis only affects around 2-3%. So it's 10 times more in eczema. And there are many types of eczema. There are intrinsic eczema and then there is an extrinsic eczema. So all these are clumped under eczema. So definitely eczema has a bigger group compared to psoriasis.
I see. Okay. So it's like under your kind of practice, a lot of people come to you with eczema more than psoriasis.
Yes,
I believe
yes,
that.
yes. I treat more eczema compared to psoriasis because eczema, number one, is that it affects places that really is problematic for you, like face. Because if you put wrong makeup or you put something chemical on your face, then you get eczema. So you straight away come and see a doctor because it affects your face. Whereas psoriasis usually affects the scalp, it's all hidden, body is hidden. So it takes a longer time for you to seek a consultation with the doctor. And the second thing is because eczema is very itchy. So you cannot sleep, you'll be scratching all over. Whereas psoriasis is less itchy. So when they affects the area that people can see and the symptom is very severe, then you come to the doctor as fast as possible. Compared to psoriasis, you wait, see whether it goes off or not, kind of thing.
Okay, so it's like Mr. Param, when you first initial onsets of psoriasis, you does not experience any itchiness, right?
No.
How long it take you to really go to a doctor?
I went within 2 months.
Oh, 2 months.
Yeah,
Okay,
first 2
because
months.
of unconscious flakiness and things like that.
Well, initially when I spotted on my skull, I thought it's a dandruff, so I didn't bother. Then I was using shampoo and all that.
Doesn't work.
That doesn't work. Well, then I spotted in my leg.
Okay.
Then only I went to the doctor.
I
Within the
see.
second month.
That explains that because just now doctor mentioned about eczema will tends to have itchy skins and psoriasis it may go undiagnosed because it's not affecting not really itchy, it's just a flakiness. So a patient will tends to drag a little longer period of time before they seek for the specialist. So we have the audience here would like to ask, shall I moisture first or apply the ointment first? I believe the audience would like to know what is the sequence of applying the skincare.
Okay. There is no right and wrong answer.
Okay.
As long as you put a cream together with the moisturizer, then it's fine. For me, what I do is if your skin is very severe, I tend to ask you to put the cream, the medication first, then the moisturizer on top. So we call this occlusion. So you try to push the medication in.
Lock the moisture.
Right. But if let's say your condition is much better, then I ask you to put the moisturizer first and then put the cream as a second layer, as if you dilute a bit of the cream so that the cream doesn't have too much of side effect. Like you use steroids. You put number one steroid first and moisturizer later, then you push more steroid in, so more side effect. So if you put moisturizer first, then steroid second, so you are diluting a bit of the steroid, so your side effect tends to be a bit less.
But it's also like effective, right?
Yeah, it's also effective. The active ingredient is still there. It still go in, but less goes in. But there is no right and wrong answer.
No right and wrong.
No right and wrong answer. As long as you use both together, then it's fine with me.
Oh, yeah. As long as you both use both combination together, there's no first or second and things like that. As long as you get enough moisture, you are fine. You are protected.
Correct.
So yeah, we have audiences would like to ask doctor, any relay of leaky gut with psoriasis?
A lot of internet and also information about leaky gut and psoriasis. I think there is a lot of information out there, but scientific research doesn't find any relationship between leaky gut and psoriasis.
Okay.
But I know of a lot of articles being written by people, usually not doctors, usually not scientists, but a lot of it actually relates these two. I think only further research will tell us, because nowadays we are looking at a lot of things on gut and skin health. So we are talking about probiotics and all those things. A lot of research is going on now, but there is no conclusive evidence yet. Just wait for the conclusive evidence to come out, then we'll know further.
I see, okay. So we all know that psoriasis, the autoimmune system, is a genetic disorder. So is it high chance that I will pass it to my next generations?
Yeah, you will. You ask me a figure, I won't be able to quote you a figure, but there is definitely you can pass it on from one generation to another. The other thing is that psoriasis sometimes can skip generation, like in your grandmother have, your parents don't have, but you will have.
Oh, skipping generations.
Yes.
Okay.
Yes.
So there's nothing that I can totally prevent this to happen or avoid this?
No, your parents might not have because there's no trigger lah.
Okay.
Because you need that gene and a trigger. Maybe the trigger is not there for your parents, it didn't come out, but in you got the trigger and pop, it comes out.
Okay, so there's nothing that I can prevent it at all. Okay, so are there any words of advice that you would like to share with our audience today who might be living with psoriasis or might know someone who is living with psoriasis?
I think psoriasis is a skin disease. It affects the nail, affects the joint. So if you get joint disease, then the disease tends to be more severe. And psoriasis affects a lot of quality of life. So if you are living with psoriasis, I think among the family members, they have to understand the patient. Sometimes the patient is not happy. Sometimes the patient is scared of doing something. You just have to adjust your lifestyle together with the patient. And if your psoriasis is not well controlled, I guess you need to seek a proper opinion from a dermatologist or a rheumatologist if you have joint disease to look at your disease, plan a proper plan for your disease, and then look at long term how to partner your doctors together to control your disease well.
I see. So like just now when you mentioned about psoriasis does have a quarter of a chance to catch a psoriasis arthritis. Is there any way to prevent that happens?
There is no particular way. Is the only way to get the psoriasis to prevent or something like prevent psoriatic arthritis is to get treatment very very early on. Yeah, the treatment usually is either immunosuppression or the biologics. You have to get it very early on. But for us, we usually don't give immunosuppression and biologics unless your condition is more severe. The mild ones, usually when your body surface area affected is very mild, we won't treat this. So to control the disease, you just have to frequently look out for joint disease. So if you have psoriasis, you have to tell your doctor that, hey, today I wake up, I got a bit of joint disease. So
or then go to a doctor.
Yes, and then the doctor will diagnose or to see whether it's really psoriatic arthritis and treat as soon as possible.
To prevent it getting worse, right?
Yes.
So we have audiences who would like to ask, like just now you mentioned about there's 3 different types of treatments for psoriasis. Are they all work the same? In terms of the efficacy, in terms of the result?
For creams, of course, if it is mild, yes, it works wonderfully. But when your condition gets worse, like Mr. Param had, cream doesn't work anymore. So you have to go up 2nd stage or 3rd stage. So whether you go to 2nd stage, the phototherapy or systemic therapy, medication or biologics, it all we need to discuss with each other. There will be a lot of counseling. There will be a lot of discussion between the patients and the healthcare provider. So which suits you the best? We want to give you the best treatment that suits you. It's not like I think it's the best. We have to have a proper discussion. Patient thinks okay, doctor thinks okay, yes, we go on to this. But if your patients think not okay, doctor thinks okay, then we cannot go.
Yeah, I have to fit to the patient lifestyle as well.
Correct. When we tailor the treatment, everything is, we call it individualized.
Like customizations?
Yes, customization. It's not like one fit all. There is no one fit all.
Okay.
What fits Mr. Param might not fit me. Yeah.
So there are, let me recap, there are topical applications, there are UV therapy that you have to go.
Yep.
3 times per week?
2 to 3 times a week.
Yeah. So it might not be suitable to those that don't have a proper logistic to back and forth from home to hospitals. So there's a UV therapy out there. There's a conventional pills to take, traditional pills to take, and also injection to take.
Correct.
As well. So the injection have to take once per month. Right?
Yes, there are various types. Some are once a month, some are once every 2 weeks, some are once every 2 months, some are once every 3 months. So they are
depends on the condition.
Depends on the drugs that we give.
Oh, right. So all the treatments are actually tailored and customized to different conditions and different patients. So if you're suffering for this condition right now, so please seek for the specialist advice like Dr. Felix Yap from Sunway Medical Center. It may reach out to you to give you the best treatment ever. So we have an audience who like to ask, how can I prevent diabetes and heart disease due to psoriasis?
Proper treatment of psoriasis and lifestyle modification.
Also to keep yourself fit.
Yes, go for exercise, reduce, get a healthy balanced diet, don't take too much of oily food, don't take too much of sugary stuff, don't take too much of salty stuff, kind of thing. Yeah.
I see, okay. So, right, so Mr. Param, is there any words of advice that you would like to share with the audience today?
I mean, you have to understand the condition. Make your surrounding people understand about your condition, change your lifestyle, and seek medical treatment as soon as possible.
Yes, because if it go undiagnosed, it may, trigger a lot of health complication as well. And also, just to remind all of the audience today, psoriasis is not infections, it's a genetic disorder. You will not catch psoriasis if you are eating with psoriasis people or you are, gathering with them. This is not an infection. So, so I'm so happy today to have both of you sharing the journey of psoriasis with all of us today. So, last question, do you have any questions that you would like to ask Dr. Felix Yap? Please catch the moment right now. If not, I'm going to just finish these sessions because I have learned so much today.
Thank you.
I have learned a lot how to differentiate between eczema and psoriasis, and I also know that there's numerous treatments that are going with psoriasis, and it's so important to seek for the advice from the specialist to know what is really tailored to my needs and what is tailored to my condition as well. So thank you so much, Mr. Param, to joining us, to your kind story that sharing with us. And so thank you so much for watching the live session. See you next time.